Hi, Keri Topouzian here, and the purpose of this video is to introduce you to our practice. And by the way, yes, I do speak English. So, what is our practice? What do we do, and what kind of patients do we see? Well, I'm an osteopathic physician, or a DO. I also practice functional medicine, which, if you would define that, basically what we do is we try to find the underlying cause of a problem. How do we do that? Well, we do it with testing, and we do various different types of testing. Blood work through Quest Diagnostics, which is one of the largest labs in the United States. Most patients that have insurance, this is covered. We also do saliva testing with urine samples, hair analysis. I have probably a dozen or so different companies that I will utilize to test different things that I'm looking for in patients. And so then what kind of patients again do we see? A lot of patients that have thyroid conditions, chronic conditions, hormone-related problems, chronic pain, hair loss, fatigue, depression, anxiety. We see a lot of patients that are not getting any satisfaction from seeing other physicians or treatments that they've been getting from other practitioners. And part of that, from what I've seen, is because the correct testing wasn't done. The other practitioners didn't necessarily look for the right things. I'll give you an example. Patients that have an autoimmune condition, whenever we see a patient like that, we will always test for three things. Heavy metals like mercury, lead, arsenic, etc. We'll look for a chronic smoldering infection that hasn't been diagnosed, and we do that with blood testing. And then we also look for food sensitivities, because a lot of patients that have a chronic autoimmune condition seem to have different food sensitivities. Or they may have all three of those. And once you come up with a diagnosis or a reason for a patient's problem, then you can treat that versus just putting them on a medication to treat a symptom. Now, a lot of patients will call this a holistic practice, which it is. Integrative, yes. I have a tendency to call it common sense medicine or textbook medicine, because, a lot of the information that we utilize is still in these textbooks that nobody looks at anymore. We also utilize compounding pharmacies, which, if you're not familiar with those, they're like your old style apothecary. They can make anything up from scratch. Very useful, especially when you're trying to narrow down a dose of a specific medication or a supplement for a patient. We also do intravenous or IV therapies. The benefit of these IV therapies is we have a lot of patients that are having trouble with absorption. Either they have a leaky gut, or they're not producing enough stomach acid enzymes. And when you administer IV treatments of different vitamins and nutrients, you're getting a higher concentration into the cells of your body. Specifically, how this also helps is that your mitochondria, if you remember that from biology, your mitochondria is the part of your cells that produce energy. If you can't get certain nutrients to the cells of your body or into the cells, you don't produce energy. If you don't produce energy, you don't feel good. We also utilize OnDemand, which is a biofeedback machine, which helps with chronic pain, fatigue, brain fog, and it's also helpful with different autoimmune conditions and infections. Okay, any questions out there? Well, if you do have a question, or if you'd like to make an appointment, you can email me at askdrt@gmail.com, or you can call the office at 248-302-0473. And we have two offices, one in Bloomfield Hills, Michigan, and also in Saginaw, Michigan. Okay, nice talking to you, and hope to see you soon.